Hi there, this is Dr. Raul Garcia with Miami Designer Smiles. Thank you for spending a little time with me. I'm going to try and explain how our office, which is called Miami Designer Smiles, how we try and help patients who are suffering from headache and TMJ problems. Often these problems start from a very young age. Typically I think of it as the big three, and I'll just use our PowerPoint here just to, I think of it like a war. The teeth, the muscles, and the joints have to be in harmony, and there's many people who have clicking and popping, other people have headaches, and I kind of like to think of it like there's 140 muscles in the head and neck area, one jawbone, 28 to 32 teeth, and 2 joint areas that all have to be in harmony. Those 140 muscles, if the teeth come in a position that the muscles are not happy, then you might have a patient who has some symptoms. Symptoms can include headaches, neck aches, earaches, vertigo or dizziness, difficulty swallowing, even postural issues can all kind of come together in this problematic world of patients who suffer from these neuromuscular problems. Some people who might grind their teeth, and so in that case, in that war of the teeth, the muscles, and the joints, that person, their teeth might be losing the war, but not everybody's grinding their teeth. Some people are suffering from issues with their clicking and popping jaws. Other people are suffering from those other symptoms that I mentioned. And so I oftentimes like to explain to patients what is it that causes these issues. And so I like to recommend this book. It's called Jaws, The Story of a Hidden Epidemic, and I like to always highlight the word epidemic because it's such a common problem. But this book is written by an anthropologist, and he basically starts explaining what are the things affecting modern men. And 150 years ago, let's say, all mothers would have breastfed their babies. And breastfeeding is a very good muscular exercise, first teaching us how to breathe through our nose and how to eat at the same time. Another interesting thing is that there was no electricity, so we were not really blending our food. The idea of pureed foods came much later. Modern man is eating softer food. Prehistoric man would have eaten very hearty food, and they would have gone from breastfeeding to gnawing on food, all good things for muscular development. We can't forget that also the world was not as polluted. Ever since the Industrial Revolution, we have been burning fossil fuels, and that's causing us a planetary issue where many people's airways are affected. Another thing is the overconsumption of dairy. We somehow think that we are really dependent on dairy. I kind of think of cow's milk is for cows, but humans, we can have it, but we can't be so dependent on it. It can sometimes cause constipation, diarrhea, eczema, but it can also cause inflammation of the tonsils and the adenoids, which is lymphatic tissue, which in developing children is going to be very small and can start causing issues that can lead to ear infections. And although that tissue is nice to have because it does help fighting infection, but if it becomes an obstruction to have proper nasal breathing, then it maybe is not the best thing. I sometimes like to show a swollen adenoidal x-ray just so people get an idea of that this is normal breathing where the tube is open. This child is breathing through their nose. This is an 8-year-old, and this is one with an enlarged adenoid. The nose is for breathing. It is filtered and humidified air. And when the body perceives an obstruction with air, the body will do anything to get air. So they will breathe through their mouth. And another interesting thing is that if we can't breathe well through our nose, we will actually put our head a little forward, and that's called forward head posture. And forward head posture is something that it's very hard to correct later on if it stays throughout our young years. And then, of course, although that we don't think that the bad posture is affecting us, but as we age, it's causing us stress in our neck, in the vertebrae, and that can actually work its way down the back, scoliosis, and many other issues. Something that I think could also affect people is when we don't have what's called the big three things that are needed for proper development is breathing through your nose, lips closed, tongue, and the palate. The tongue is a very important expander, a very important muscle that creates a good sized arch. And prehistoric man had very ample arches because they had better development because of what I mentioned previously. But when we don't have sufficient room, we don't get room between the baby teeth, and then we get insufficient development as the years go by. And orthodontically, sometimes the treating orthodontist might say we need to sacrifice some teeth because there isn't sufficient room. Our approach is to look at the airway first, and to also look at tongues and tongue ties, and see if there's things that are burdening that person's system, keeping them from doing the important big three things. If it's determined that they didn't have enough room, and someone decides that they want to have premolars or bicuspids removed for orthodontic treatment, the muscles in the head and neck area and the joint don't quite understand that that's happening, and the person's jaw still wants to be in a more forward position. Many people lead to having more of a trapped jaw issue, if you can think of it that way. Think of our mouth room like real estate, and if we pull out teeth, I think of it like the tongue is a lion in a cage, and if we've made the cage too small, it can obligate the tongue to sit a little further back, and it can also cause muscular compression. And I think of the muscles in the head and neck area as compressed when they're sacrificed. And this could happen to somebody who's never had braces. Braces is only one factor, but it can happen to people under any circumstances. Never had braces, had a history of braces, had a history of orthodontic extractions or not. I'm just kind of trying to mention all the things that can kind of come together for certain people. One thing we do that I think is great is that we have our training at Las Vegas Institute for Advanced Dental Studies. Everybody calls it LVI for short. And there's dentists trained like me in certain cities in the United States, parts of Canada, parts of Australia, and there's one in England, but there's frankly not enough in the world. But one of the wonderful things about being trained as a physiologic or neuromuscular dentist is that we have a computer that allows us to see what's happening with the muscles in the head and neck area. And so that's a part of the system, meaning that most dentists are focused on the teeth, and maybe you go to someone who says that they're a TMJ specialist and they want to do surgery on the joint. But the truth is that if they are ignoring the muscles, to me they're ignoring the most important and the most dynamic part of the system. When you think about this muscle exam, think of it more like an EKG. An EKG is the heart muscle, and if the heart, when the cardiologist is looking at the heart, they say whether the squiggly line is normal. For us, we're looking at the temporalis muscles. Right and left temporalis are commonly associated with headaches. Masseter muscles, which has to do with chewing. And the next is the sternocleidomastoid, which has to do with postural issues, and it shows us how we carry our head. And the lower is the tongue. On the left side of the screen, this is someone who's getting their muscles checked. And on the left side, basically we say, keep your teeth apart. And that allows us to kind of see muscle health and that they just have normal movement, and this we're very pleased with. But when we say, close your eyes and put your teeth together, this is not normal. This is someone who has to do a lot of muscle energy to put their teeth together. So I try and correlate for the patients that we treat for TMJ and pain, I try and correlate for them that the muscle exam is correlating to their symptoms. And so there's a technique called TENSing, which stands for transcutaneous electrical neural stimulation. And TENS units are very commonly used in physical therapy. And so it's a therapeutic way to relax the muscles. Think of it like getting a massage. So this therapy allows us to do something great, because when a patient's TENS, this is what their muscles look like after. I call them happy muscles often, and I say if we can find happy muscles, then this is where we should be treating a patient. And so we can either design a smile for them, that we can fix their bite, if you will, because you can't be mistaken. When people are grinding and clenching their teeth, when they're in pain, their bite is physiologically pathologic. It's a broken system. So our job is either to make them an appliance where the muscles are happy, or correct their bite using porcelain to where their muscles are happy, or if they have nice looking teeth, they could actually orthodontically have their teeth move to that position. And that's a great way. That's very conservative. Anyone at any age who has a good amount of teeth that are nice looking teeth, that they can actually have their teeth moved to this position. Orthodontists are trained to move teeth, make them look straight. They try and do a great job, and for the vast majority of people that works, but there's a segment of the population who needs a special kind of orthodontic treatment, because you need to have these things looked after. You can't just move them. I think of pain patients as field goal in football, and I say someone who's in pain is outside of their zone of comfort. And so our job is to try and get them into their zone of comfort. As part of our workups, we always do a 3D x-ray called a cone beam CT. It's a low radiation head and neck x-ray. We also do an analysis on that, and we do a radiology report, because we want to make sure that we're not ignoring something pathologic that the patient could have that we're never going to get resolution for. And we want to give people hope that we really think we can help. And we don't want someone wasting time, energy, or money in something that we feel like we cannot help them with. I normally think of our success, about 80% of people who do the muscle exam and have treatment with us, their symptoms are improved, usually anywhere between, depends, but 50 to 75%, I think of it as a successful treatment for the patient. And only the patient can decide, but there's ways to test the muscles and to allow the patient to have the experience of feeling better. And so I encourage people who have head and neck pain to seek out a neuromuscular or physiologic dentist that can help them. We happen to be in Miami, Florida, but there's others. There's another in Jacksonville, and you can actually go to our website called, our website, MiamiDesignersmiles.com, if you want to see more on our website. But you can actually also go to the LBI website, which is called www.lbiglobal.com. You can put in your zip code of your country or city and try and find a dentist that can help you. I'll be quite honest, there just is not enough of us, and many people have to fly or drive to find one. And I think if you're a pain patient, it might be worth your time to hop along that journey, because a life with pain can be compromised with anxiety, depression, and sacrifice quality of life. And anything we can do to help these patients to feel better, is it's our passion-driven purpose to help people, feel better. And I don't like to offer false hope, but I know I've helped many people, and I get up every day thankful that I'm, the things that we've been learning have helped many people in our own family. I'll say we've been dentists 27 years, but about 14, 15 years ago, we landed into these courses and we saw things that we thought we could help our children that were small at the time. And frankly, it's kind of changed our practice, changed our life. And my wife and I are both very grateful for the training that we've had, that now we are lucky enough to be able to help so many people. I don't think we could have predicted the power of the internet 15 years ago, and now people seek us for this particular kind of treatment, and it's very fulfilling. And so I hope that this video brings you at least some answers to some of the things that might be affecting you. I find it interesting, many pain patients, sometimes they're looking for 3 weeks, but sometimes it's for 20 years. They're looking for solutions, and they've had many failed treatments, and they're frustrated, and no one has looked at them from this perspective. And I think, it's great if someone who needs a neuromuscular or physiologic dentist finds one. Then it's a great marriage for the patient, and for the dentist, it's a fulfilling thing to be able to help those patients get better. Our medical doctors are sort of, they compartmentalize medicine, and they're also specialized. That the neurologist, if you talk about headaches, you might say the neurologist can't find anything, and the OBGYN might say it related to the period, and the ear doctor might say, well, your ears are fine, or your sinuses are fine, and the neck doctor doesn't quite understand that this is also related to shoulder pain and frozen shoulder, and how a tongue tie could be connected to plantar fasciitis or bad posture. And so one of the gifts of being trained as a physiologic dentist is the fact that we can sort of tie together for people something that's happening with their feet, something happening with their posture, something happening with their head or their ears, and symptoms that don't seem like they go together, but for us somehow it gives you a glimpse of someone who's suffering, that you can actually listen to their symptoms and say, I understand where you're coming from, I think I can help you. And from my experience, patients rarely get that feeling that someone actually doesn't think that they're crazy. And I hate the idea that there's a theory out there about TMJ, or that the patient should get Botox, or they need to relax or do yoga. There's a theory called the psychosocial theory, and I kind of feel like it's insulting, because I just think if we can put you on a computer and we can physiologically find where the areas are of higher compression of your muscles, and if we can help you fix the structure, why would you tell someone to just relax? We all have burdens in our life that we have to carry, but if we can help the person unburden their physiologic system, and they feel better, and they're able to lead a productive life again, why not? Thank you for spending a few minutes with me. And my name is Raul Garcia, Miami Designer Smiles, and I hope you have a beautiful day.